Well, welcome back. I meant to ask, do you like prefer being called Doc, Dr. Alex, Alex, Al?
Just Alex, because if you say Dr. Cahana, I'll say, is it mom, dad, my sister, grandpa, grandma? So I'm just Alex. Go ahead.
Got it. That may have answered some of your influencer stuff there, actually. But so I talk a lot about influencers. I mentioned my grandfather to you in a previous video, and they come in all sizes, shapes, languages, you name it. Some come for a split second in time, and some come over a longer period. Give us a sense of one or two influencers that have impacted your life.
Yes. I'll mention two. One is implicit in your question is my maternal grandfather. So I'm fifth generation of doctors. The first one, was the doctor in the court of Kaiser Joseph the First, and so this big diploma. I have like this tiny card, and he has this big diploma. And
it's not about size. Doesn't matter all the time.
That's true. But Grandpa Nicky or Oteta Nicky or Nicholas, he in his last year of his life, it was my bar mitzvah year. He would take me every day after school. I would go to his clinic, and I would see with him the last patient. And I was just enamored by the human connection. And all the stories that you hear about how we used to pay doctors with chickens and pies and cheesecake, they're all true. That's how it was done. And he taught me to listen. He taught me to care. He taught me to really share, communication, from Latin communicare, to share.
Mm-hmm.
And this leads me to the second hero in my life, or heroes in my life. And I don't know, maybe your audience, they're listening to it, I'm sure that they know that when someone talks to you, you have voices in your head. It's not that you're crazy, it's just that's how the brain works. And those voices in your head are the voices of everyone except you. And so the ones who influenced me most, my second heroes, are all my patients. And I've seen, for close to 26 years, over 50,000 patients and visits. And every time I would see them, I would always ask the same question and finish with the same answer. I would ask them when they walk in, tell me in your own words what you think I should know so I could help. I wouldn't say, do you have pain? Because of course they have pain, that's why they're saying pain. But I would say, tell me in your own words what you think I should know so I could help. And they would say, oh, my L4, L5, and I'll stop you here, use your words. And they would say, John died and the kids left the house. And then I would understand what the problem is.
Mm-hmm.
And so when they left, I always said to them, thank you. And they would say, what do you mean, thank you? I'm thanking you. I said, no, I thank you because thanks to your story, I now know more about what pain is with a capital I. And so those are my heroes.
Wow. Yeah, that's brilliant. It reminds me of a teacher. It reminds me of so many people that do listen, and we judge so fast these days instead of listening. That's a great share. Thank you so much for sharing that.
Thank you, and thanks for the wonderful questions.
My pleasure.